Let's discuss liver 14, front collecting point. This is also called the cycle gate, Qimen. Location in the 6th intercostal space on the mammillary line or fourth zone lateral to the midline. How to find liver 14? So we have a quick method, especially in men. The nipple is generally located on the level of the 4th intercostal space. From there, palpate downward 2 intercostal spaces and locate liver 14 in the 6th intercostal space. Or, for more precise orientation on the rib cage, palpate for the manubriosternal synchondrosis, a well-defined horizontal bony structure on the sternum. Lateral to it, locate the 2nd rib and below it, the 2nd intercostal space. From there, count downward 4 intercostal spaces to the 6th intercostal space, and there locate liver 14 on the mammillary line, fourth zone lateral to the midline. GB24 is located in the 7th intercostal space, located on the same level, tooth zone inferior to the sternocostal angle, are REN 14 on the midline, kidney 21, 0.5 zone lateral to the midline, and stomach 19, tooth zone lateral to the midline. Needling 0.5 to 1 zone obliquely, either in a lateral or medial along the course of the ICS direction. The latter is recommended for disorders of the breasts. Caution, pneumothorax. Actions, indications. Liver 14 regulates liver qi and liver blood, especially in the upper and middle burner, cools the blood, disperses accumulations, harmonizes the liver and the stomach. Special features, front mu point of the liver, meeting point with the yin wei mai and the spleen channel, exit point. Liver 14 has a similar function to that of liver 13. The main difference being that liver 14 affects mostly the stomach, whilst liver 13 affects more the spleen. Please note that there is an alternative location for liver 14 at the lower edge of the rib cage, in line with the nipple, or in women, fourth zone from the midline. In fact, one could look upon this as 2 separate points. The one in the intercostal space is used more for channel problems, while the one at the lower edge of the rib cage is used more for organ problems. So here is a figure demonstrating the alternative locations of liver 14. This point is frequently used whenever liver qi stagnates and invades the stomach, causing belching, nausea, vomiting, and hypochondrial distension and pain. It harmonizes liver and stomach qi. The pulse is typically wiry on both middle positions. To summarize the function, it promotes the smooth flow of liver qi and harmonizes liver and stomach. So there will be hypochondrial distension, sighing, breast distension, epigastric distension and pain, hiccup, belching, vomiting, and hardness of the epigastrium. Liver 14 is the last point on the liver channel, and indeed the last point in the great circulation of qi, which begins at lung 1 and passes through all the 12 channels, ending one complete cycle at this point. This is reflected in its name, cycle gate. Liver 14 is the front mu point of the liver. The term mu means to gather or to collect, and the front mu points are where the qi of the Zang-Fu gathers and concentrates on the anterior surface of the body. It is in the region of this point that the liver channel spreads through the lateral costal region, diaphragm, and chest. Its main sphere of action, therefore, is on regulating the free flow of qi in these areas. And in contrast to liver 13, which focuses on the middle and lower jiao, liver 14 acts primarily on the middle and upper jiao. The spiritual pivot states, With anger, the qi rebels upwards and accumulates in the chest. If liver qi is obstructed in the chest or lateral costal region, there will be pain, distension, or fullness. Whilst if liver qi invades the lung and obstructs its descending function, it will give rise to cough, sighing, and dyspnea. The liver sinew channel links with the breast, and the entire breast region is strongly influenced by the liver. If liver qi is obstructed in the breast region, therefore there will be pain, distension, and even masses, all of which may fluctuate with the menstrual cycle, being most pronounced in the days immediately prior to menstruation. Liver 14 is an important adjacent point in the treatment of this common condition. The intimate relationship between qi and blood is clearly expressed in the saying, qi is the commander of blood. When qi moves, blood moves. Severe or prolonged qi stagnation, therefore, will lead to blood stasis, manifesting as hardness or masses with cutting pain in the chest, lateral costal region, abdomen, or hypogastrium. Liver 14, by virtue of its ability to circulate both qi and blood, is indicated in all these situations. Liver 14 is also specifically indicated for cutting or stabbing pain of the heart, reflecting its status as a meeting point of the liver channel with the yin linking vessel. According to the classic of difficulties, when the yin linking vessel is diseased, heart pain will result. According to Zhang Yue, if anger occurs during or after eating, it injures the stomach and spleen. This vital observation emphasizes the great importance ascribed to a peaceful and harmonious state of mind during mealtimes. If instead there is disturbance, conflict, frustration, resentment, or outright anger, they may wreak turmoil in the digestive system. If liver qi transversely invades the stomach in this way and impairs its descending function, the stomach qi will stagnate or rebel upwards, leading to epigastric distension and pain, acid regurgitation, vomiting, and hiccup. Liver 14 is an essential local point in the treatment of this pattern of liver-stomach disharmony. If liver qi transversely invades the spleen and impairs the spleen transportation and transformation function, there will be abdominal distension and diarrhea. Although liver 14 is less used clinically in this situation than liver 13. A specific indication for liver 14 is injury by cold leading to heat, which enters the blood chamber. This refers to attack and penetration of cold during menstruation or after childbirth. The cold transforms to heat and gives rise to alternating fever and chills, hardness and fullness in the lower abdomen, chest, and lateral costal region, and clear consciousness during the day with disordered speech at night. This pattern was first described in the Treatise on Injury by Cold by Zhang Zhongqing, who recommended the administration of minor bupleurum decoction and needling liver 14, especially in the case of manic raving. The Tang Dynasty author, Xu Xuexu, a scholar of the works of Zhang Zhongqing, in his discussion of the Treatise on Injury by Cold, said, concerning heat entering the blood chamber in women, when Shao Chai Hu Tong is too slow, needle liver 14. Liver 14 is also indicated for uterine bleeding. Finally, like liver 13, liver 14 is an important point in the treatment of running piglet qi. Thank you for your attention.